So, first slide is a history since we started the survey of the reporting we've got back. As you can see, the last couple of years has taken a significant jump in both the number of plans and the number of members that have reported. If you don't remember getting a request for this, that's because 2 years ago we started to gather it by asking TPAs. So we'd go to all of our TPA partners and ask them to provide us with all of the SBCs for the members that we have with them. If we couldn't get them that way, then we'd reach out to you, the member, or your broker to get those. The reason this is important is what my goal is and our goal is to be able to report historical data. So 3 years from now, we can say, if you look back, when we had the vast majority of the plans in place, it gives us a better starting point and gives some validity to what we see going forward. So this is one of the slides that came from the verification survey. As you can see, the vast majority of plans are still PPO programs with the Alliance. The 4.6% of others, those are EPO plans that a couple of our members have. What I found interesting on this is the number of high deductible health plans stayed the same over the last couple of years. In the fully insured market, in the small under 150 group segment, it's really starting to become a dominant player there. In talking to Paul, part of that could be because of the significant increase in the number of plan designs we have. Part of it could also be because of the number of members who are offering multiple offerings as opposed to just one. So health plan contributions. The big thing I saw on this slide is there's still members who pay 100% of the coverage for their employees. That is cut in half from last year. The overriding majority are in that 70 to 90% range. The average is 78.9% across the Alliance population. As you would expect, the larger employers still have the lower deductibles, that 0 to 500 range. The average Alliance employer, which is a group of about 192 employees, have the magenta line there, and their deductibles range from $1,000 to $2,000. This is just a two-dimensional slide that represents what we just saw. And again, it points out that the zero deductibles are still a few, but those are going down as well. What I found interesting was the $5,000 deductibles are starting to grow. Maximum out of pockets, historically in the past, those have been 2, 3, 2.5 times of what your deductible is. Still pretty much a true statement, but what we saw in a year-over-year comparison was that the out-of-pockets between $4,000 and $6,000 have started to creep up. And again, when you get to that $10,000 out-of-pocket cost, we're seeing that grow as well. Because the PPO is still the dominant plan type within the Alliance, copays are one of the ways that we pay for those. The $20 copay, which seemed to be the standard for the last number of years, has creeped up a little bit. You'll see the $30 copays are starting to gain some traction. When you get to the specialist copay, which a lot of our plans have a split copay now, $50 is the norm, but we've seen them creep up as high as $75 or $100. This is a slide that you'll see a couple of times throughout that'll be very similar. When it comes to cost share, the 80-20, the 90-10, still the dominant way that employers share the cost with their employees. But again, you start to see the 50% come in. We don't see a lot of it, but I think you're going to see that continue to grow going forward. So diagnostics, tests, and imaging. When we look at these, what I really found interesting is on both of these donut slides, there's a portion where it's not covered. I've been to a handful of employee meetings. I know Paul Rolke, the other member service advisor here, has as well, and I've never heard that talked about. In Ben's presentation, he mentioned that sometimes employees are taken aback when they find out about plan design. I think that's something that employees would be shocked to know. So the diagnostic tests, in this time of year, these come up a lot. Strep throats, mono tests, blood work. Imaging is primarily CTs and MRIs, which is going to be a nice plug for our Quality Path program. This is a piece that is available for all members. If you haven't seen it, let us know, we can get it for you. And what it really does is show you, in the last 2.5 years, how many CTs and MRIs did you have, and what those costs were. Now, if you become a member or you are a member of Quality Path, it shows you some potential savings. Keeping in mind that if you're Quality Path, one of the plan parameters we have is you waive the deductible if you're a PPO plan, deductible and coinsurance. If you have an HSA compatible plan, for scans, we require that you give the employee $100 if they see a Quality Path provider. At the very bottom, it gives you the list of the top 5 providers that we're seeing in that last 2.5 years. The one thing we always do point out is the savings are annualized, so we don't put those in a lump sum. So you can see some significant savings here. One of the questions that we got when we rolled out the plan design was, if I waive the deductible and coinsurance on a CT or MRI, isn't that going to adversely affect my spend? So what we developed with the help of our data team is a chart that shows the orange bars are each individual employer, and the blue curve, blue dotted line is the alliance spend as a whole. And what you'll notice is, for the folks who have CTs and MRIs, they have significant healthcare concerns and things that are ongoing. So the majority of them are going to have $15,000 in repriced claim spend, so that waiving the deductible really doesn't have much of an effect on your spend at all. Diagnostic service testing, how is this being paid for right now? And it looks a lot like the coinsurance we see on other slides. The 10% and 20% coinsurance to the employees is dominant. Not as many in the 50% range as we saw earlier, but still we're starting to see some creep there. This look familiar as well. Outpatient surgeries, the 10 and 20% again are dominant. When you get to out of network, it doubles, which has really been the standard for a number of years. I think we'll start to see that shift a little bit as employers try to drive folks in network to get some steerage and some savings. There's really been 3 areas that we get a lot of questions on. What are other members doing? The first one we're going to talk about are prescription drugs. The vast majority of drug plans are still paid for with copays. There's some coinsurance. The unique orange bars here are some combination of those. There are a couple that are really unique that we didn't put on. One thing we're seeing more and more, at least having questions on, is adding a 4th tier. I don't know if from the brokers in the back, if that's something that you've done a lot of. It wasn't statistically significant, which is why we haven't added it to the slide. But as pharmacy costs continue to grow, and it's the Hep Cs and it's some of the new cancer drugs and the rheumatoid arthritis drugs, as a way to help control those costs, you'll see a 4th tier or a specialty tier being added to the prescription coverages. The other thing we get a lot of questions on is what's going on with emergency room copays. How are folks paying for those? What are other members doing around urgent cares? And it's really all over the board. Again, I was kind of astounded to see that there are some plans that don't cover emergency rooms or urgent cares. So again, as long as we're educating our employees on that, I think that's going to be all right. This is a shameless plug for member service visits. What Paul and I like to do is get out and see all of our members at least once a year, and we can bring a number of reports that are Alliance specific. One that we really like to look at is one that compares each individual's members' usage of emergency rooms, urgent cares, and office visits with the rest of the Alliance membership. And what you'll see, make sure I get this, is it gives you some historical trends. for this employer, their folks are using the emergency room maybe a little more than the rest of the Alliance membership. But when you look at the fact that the costs are significantly higher, that leads us to believe that they're using the emergency room for what it's meant to be used for. The same with urgent care. This is an employer who historically has a lot of urgent care use. I think once we get a full extra year of data here, you'll see that 53% start to normalize a little bit. And these are reports that are available to you at any time. So when you and your brokers are starting to look at what you're going to do next year with your health plan, let us know. We can get you those. Hospital benefits, again, it's the 10 and 20% co-insurance, which are dominant. One thing we have seen as a trend is starting to add co-pays before that. Most of them are relatively low. We do have a couple of plans that add $1,000 co-pay to hospital benefits as well. Here's another thing that we get a lot of questions on. How are other members covering behavioral health, alcohol and other drug issues, and inpatient behavioral health? Again, I would think that when you look at the outpatient behavioral health and the outpatient AODA, those would be almost identical. Again, I'm surprised at the amount that it's not covered. So the health recovery services, these are things that were mandated by the Affordable Care Act. As you would imagine, the habilitation, because it's not required in a self-funded plan, there are a lot of programs that don't cover it. I still think that would be very hard to cover. How do you measure something that wasn't wrong? But the majority of these, again, are covered still by co-insurance. This is another slide that we get from the member verification form that we started to track very significantly more in the last couple of years. It's what kind of stop loss do our members have? The average is $105,000 of stop loss. And much like the other window pane slide that we looked at, the larger employers have the higher attachment points. I also found it interesting that almost 27% of members buy the laser-proof coverage. It's always an interesting discussion to have with employers and members is, do you want to buy it? Why not? It adds a little bit to your premium, but can save you in the long run. The last slide we got is on employee surcharges. This is also a piece that we got from the employee verification report. So the yeses and nos are responses we got. The unknown, we took the entire Alliance population in here. So the 38% are folks that did not respond to it. I'm most surprised about the smoking surcharge. I would think that as employers look for ways to keep spending down, they'd try to change behavior a little bit by putting a surcharge on the smokers. We did hear about what I think is a pretty unique way that one broker has looked at this. What they're doing is, if you have access to insurance through your spouse, they will look at providing you the premium that your spouse pays and the total out-of-pocket cost for you to move to that program. When you look at if the total out-of-pocket for a family is $8,000 and the cost of your spouse for that insurance is $6,000, that $14,000 is probably a small percentage of what the claims would be if you stayed on the employer's plan. So we'll be interested to see how this progresses throughout the next couple of years. So that's what we had for this. Any questions on any of the slides you saw, let us know. When you get your feedback form, what I'd like to hear from you folks is, what other things would you like to see in the report? Outside of the SBC, the verification form, we can amend and change to try to gather some of that information. So please give us that feedback, and we'll try to incorporate that going forward.